Okay, everyone. I know a few people joined us in the last minute or two. So I'm Karen Scozzina. I'm a pediatrician and faculty member in the ETSU Department of Pediatrics and director of the Child and Family Health Institute. If you haven't already, feel free to introduce yourself via the chat. Thank you for joining us for today's CFHI Collaborative Series meeting with presenter Dr. Diana Moreland. The Child and Family Health Institute was established in March 2020 with a mission of promoting research, education, service, program development, and advocacy to better understand and address the needs of children and families through interprofessional and transdisciplinary collaboration. And I see that many of you have joined us in prior months this fall for this series. Just a few housekeeping items before we get started. Feel free to enter questions or comments for Dr. Moreland and the group via the chat at any time, and I'll help to kind of monitor and keep an eye on that. So I can share those comments and questions, but I believe she'll also have time at the end of her presentation for discussion and networking. We do record these collaborative series meetings and post those on the CFHI website. We also invite everyone to, turn on your cameras, just to make the meeting as engaging as possible, but at the same time, we recognize that we are all working from different locations and under unusual circumstances. So I completely understand if that's not possible. So Dr. Moreland is an assistant professor in the Department of Psychology here at ETSU. She is a licensed clinical psychologist and has a specialization in infant and perinatal mental health. She is active in her state's Infant Mental Health Association. She is a founding member of the ETSU and Ballad Health Strong Brain Institute. She also brought and oversees a trauma-informed parenting program that originated out of Michigan called Mom Power to our region. And she is a co-founder of the regional nonprofit, the Appalachian Perinatal Mental Health Alliance. She is going to be talking with us today about care of the caregiver during the time of COVID and science and practice of self-care. And that's something that I think we could all benefit from right now. So thank you again for presenting and facilitating our discussion, Dr. Moreland.
Thank you for having me, Dr. Scozzina. And it's good to see everybody. I see a lot of familiar faces. I'm going to jump right in with the question that those of you who know me will not be surprised I'm about to ask. I'm going to ask how you are, and I am grateful everybody shared where they're coming from, so you can skip over the agency and role. But if you would, I'll invite you to share in the chat box a word or phrase that captures how you felt this week. A word or phrase that captures how you felt this week. Just put it in the chat box. I'm starting us off by sharing that I felt overwhelmed. Dr. Scozzina, stressed. Thanks for your honesty. Heavy. Just keep swimming. Yes. Stressed. Some hopefulness. Resolved. Lots of different places that we're at. Thanks to those of you who are willing to share. Just want to recognize that as we think about taking care of others, it's important for us to pause and reflect on how we are in this work. Defeated, yeah, there's a lot. We are at the end of 2020. Those of you who grade, we're in the midst of grading. The holidays can bring both joy and stress, so just wanted to acknowledge where we are at in our own processes. Thanks everybody for sharing. How are parents and young children doing? You all, a lot of you work in the field, and so I really am eager to hear what you all are seeing. So my question to you all, if you'll put it in the chat box, are what are some of the ways families and young children are being impacted by COVID-19? I know there's so many ways, so no right or wrong here. Yeah, loss of routine, huge one. Loss of childcare, huge one. Separated, yeah. Lots of separation, not being able to be with the caregivers we're used to being with. Oh, somebody was feeling isolated, and yeah, the kids are isolated. Absolutely, it's huge. Kids and families are stressed. There's absolutely some positives to this pandemic, that some families are brought together and are finding resilience. There's a lot of confusion about being home from daycare, abundance of caution, especially now that things are spiking. Miranda, thanks for your honesty. 4-year-old sitting on your shoulders. Yes. Yeah. I think those of us with kids have had a lot of creative Zoom calls. Work from home struggles. Yeah. Thanks everybody for sharing. Lots of ways that kids and families are impacted. I want to save a lot of time for like why this matters and what we do about it. So I'm going to go through quickly some of the stressors. You all, I think, understand them or are naming them. So some of the stressors that we're seeing on children, the CDC has a nice resource kit out. I put the link there. I'm happy to share these slides afterwards. Those changes in routine. Early childhood is a time where routine helps kiddos feel safe. It's true across the lifespan. Routine helps us feel safe and regulated, but especially in early childhood, we know routine is key for building regulation and safety. We also see that kids are just having that disruption in continuity of care. So they might be in childcare and then home. There might be different caregivers than they're used to, and how much that is important for all ages, and especially in early childhood when we think about those early caregiving relationships, building the foundation of attachment relationships that build the foundation of how all relationships go across the lifespan, this being a really key time. Additionally, there's breaks in the continuity of healthcare and access to that. A lot of you who know me know I have twins that are preemies and have had a lot of complications at birth, and they're meant to be followed up pretty closely by a lot of specialists, and a lot of those specialist appointments are being canceled because of COVID. And so recognizing that children, maybe aren't getting access to the healthcare that they were historically. Missing significant life events. Those of you with kids who have had birthdays, you know how sad it is to not be able to celebrate those birthdays with loved ones. Kids notice. There's a lot of other big life events too that our kiddos are missing out on. Just these normal rites of passages. Again, toddlers, I'm thinking about the tradition of sitting on Santa's lap. Is something we're not going to do this year. The first day of school being a really special thing, and it was probably scary and confusing for kids this year, those sorts of things. Loss of social opportunities and access to just normal play dates. We know how important social development is, and so recognizing that. And just loss of safety and security. I can't stress this one enough. When adults don't feel safe, kids pick up on that, and kids don't feel safe. And kids know when something is wrong. And so as adults face this uncertainty and don't feel necessarily safe, and routines are disrupted, and there is no normal, kiddos soak that in and pick up on that, and it impacts their social and emotional well-being. So again, I feel like I'm preaching to the choir. A lot of y'all know this. This comes from the CDC. There's tons of resources out there depending on where you look. But just some tips for helping young children during this time, and helping caregivers help young children, are to maintain a normal routine as much as you can, maybe even creating a new normal routine now that nothing is normal. Talk, listening, and encouraging emotional expression, even for our nonverbal kiddos. Helping put things in small stories can help them make sense of the world. And so talking about people wearing masks, talking about why we don't go places. I think a lot of folks historically thought because kids don't necessarily bring it up. They don't know, and we shouldn't tell them. But really, kids are beautiful little observers and explorers taking in their world. And if we don't tell them something or talk about something, we're telling them it's too scary to talk about. And so being able to take these big things and put them into words for them. Finding ways for kiddos to explore safely. We're going to talk in a moment about why exploration is so crucial to development. And right now, exploration is really inhibited. Exploration is things like learning, playing, socializing, literally exploring environments, going to new places. And so, of course, that is restricted during COVID. And so getting creative in ways for them to explore that feel consistent with one's family values around COVID. Giving honest, developmentally appropriate information and accurate information. I'll give you some tools on how to do that at the end, and then simple steps to stay healthy. Now, stressors on parents, right? It's not just the kids who are being impacted by COVID. It's really the parents, the caregivers, those taking care of them. So I'll briefly kind of go over some of the stressors impacting parents. They too are impacted by changes in routine. Kids love routines, so do we adults. And when we remember and acknowledge them and lean into them, and when we don't get our routines, we get grumpy too. Routines help us feel safe. Y'all know working at home brings a whole host of stressors, especially without childcare or kiddos being home from school. Job instability, economic stressors being a huge stressor, worries and fears related to the pandemic, anxiety symptoms are higher than they've ever been in my lifetime for the general population, being socially isolated. We're seeing a lot more relational conflict, marital conflict, co-parenting conflict within across-generation relationships, parents, kids, grandparents, navigating holidays and who can come and who can hug. Lots of relational conflict and stressors on social support systems. And then at the high end of that risk continuum, we're seeing greater risk for intimate partner violence for those who are in those situations, and decreased access to social support. And then I can't talk about parents without talking about perinatal. So all of these things are true for our pregnant and postpartum mamas, and then you add additional stressors. Y'all are intelligent folks. You can think about all the ways COVID is impacting a mama's ability to go through pregnancy and postpartum. I put some numbers up there. I've got citations at the end, but just know that our mamas are at greatest risk now more than ever for experiencing mental health struggles during pregnancy and postpartum, feeling isolated, feeling stressed, and having trouble bonding with their baby because of those mental health and stress difficulties. This comes from the CDC. This was done in June, so it's been a while. It's kind of the early data. My guess is that it's gone up, and I'm sorry I don't have more recent data. But during June, 40% of US adults reported struggling with mental health or substance use. You could see there 31% of adults were reporting anxiety or depression symptoms. About 1 in 4 were reporting trauma or stressor related symptoms. About 13% were reporting kind of starting or increasing substance use, and about 1 in 10 adults at that time were reporting that they had seriously considered suicide recently. So just some staggering numbers of how mental health is being impacted across just the general adult population. And then holding in mind our disenfranchised and disadvantaged groups. Younger adults don't really fall in that category, knowing that younger adults had some of those higher numbers, but then our racial, social, ethnic minority folks, unpaid adult caregivers being a particularly high risk group, and folks being in lower socioeconomic statuses. So just recognizing that folks who are kind of already on the margins are also at greater risk for getting COVID, being impacted by COVID stress, and struggling with mental health difficulties. And then I should also add having lack of access to adequate treatment for those mental health symptoms. So just holding in mind that sad and hard risk umbrella. There was a recent paper published in Child Abuse and Neglect around trying to understand how stress is impacting parenting during this time. I'm going to share a little bit from that paper with you all. So I'll tell you a little bit about the sample. The sample was about 180 adults who had a child under the age of 18. So this is not just young kiddos, but any kiddo under 18. It was done out in the Rocky Mountain area, so kind of more West Coast. They had a decent distribution of racial and ethnic minorities. About 33% of their sample was college educated. About 33% of their sample was on food stamps or other government assistance, indicating lower economic status. So from my perspective, when I'm used to seeing a lot of kind of predominantly white, rich, educated samples, this was a fairly representative sample of parents. And what this is showing you here is that the majority of them, 86%, reported COVID was adding stress related to their mood. So mood symptoms or stress symptoms. Over 50% reported parenting stress related to physical health. Those of you who have partners in your house probably are not shocked by this number. 62% reported that it was causing stress to the parenting relationship and interactions with partner. Again, 63% was impacting and stressing the parent-child relationship. And then, almost half of the sample was reporting that it was impacting their child's learning. I will say in other papers, those numbers are higher. It's about 75 to 80% of parents reporting stress and concerns related to their child's academics or learning related to COVID. At that time, about 55% knew someone who tested positive for COVID. About 1 in 4 knew somebody who had passed away from COVID. 81% of the sample had high clinically significant anxiety symptoms. 69% of the sample had clinically significant depression symptoms, and 86 reported poor sleep within the last week. So just a snapshot in this one particular study of how COVID stress is high, mental health is high, sleep problems are high, relationship problems are high. In terms of specifics related to COVID-related experience, this is just another table from that paper, breaking down some of the specific types of stressors related to COVID that were adding to their stress. I'm not going to read this whole table to you, but you can see that the most commonly reported one was kind of economic stress, loss of employment, also inability to socialize, that isolation we've talked about, difficulty managing work from home. But then I don't want to ignore the positive. There's always resilience. We are resilient people. And so some people kind of reported that they were finding strength in the fact that they were able to spend more time with their family. This is a model that 2 researchers, Zhu and Wu, adapted from an older model to try to present a framework to understand how COVID stress can lead to challenges in parenting. We know from the parenting literature that the more stressed a parent is, the less effective they tend to be in parenting. They're less sensitive, they're less patient, they're less attuned and empathic with their young kiddos. And I think we can all make sense of that. And here, this model just helps break it down a little bit more, that talks about how really it comes down to the COVID stressor, but then there's kind of other things that come between. So one is that kind of A to B, kind of COVID stress related to a parent's resources or strengths. So here we're looking at kind of internal resources of kind of my own, for example, emotion regulation abilities, my own mental health, as well as my social support resources, the networks, my village that I have to lean on in times of stress. And then you go up to C, and that's parents' perception. And that's realizing that stress is something that is subjectively appraised. We can take an event and our thoughts and feelings about it kind of determine how stressful that is to us. Getting ready for this talk today, I had those butterflies in my stomach, and, part of me can think like, oh, I'm so stressed, I'm so nervous to give this talk, and kind of let my anxiety go up. And part of me can think, I'm so excited to give this talk. I really care about this topic and I want to do it well because I respect the folks in the audience and I really think it's an important thing to talk about. So same event, different appraisal impacts how I'm going to respond and how I'm going to be able to cope with those feelings I'm having. And so kind of thinking about that interplay between how I perceive an event, what inner resources I have, as well as what external resources I have to help cope with it, and all of that then going on to impact parenting. And this particular paper was talking about risk for maltreatment, as well as just kind of general ineffective or unhelpful parenting strategies. All right. Those of you who know me probably aren't surprised that I got the tree in here somehow. So why does this matter? Why am I so kind of concerned about parent stress in the context of what it means for young kiddos? And really, to me, I can't think about young kiddos and parenting and the relationship between them without using this tree metaphor. So I'm going to share it with you. It's a metaphor that comes out of the Mom Power curriculum. So it's one we use to teach mamas about early attachment and bonding and relationships. And it's one that helps me approach my work with parents and kiddos, but also just helps me approach all my relationships with my kids, with my partner, with my mom, with my coworkers, and beyond. So here's the tree. The tree represents the way that we all learn, grow, and thrive. And just like a tree needs strong roots to be able to grow and be strong, our kiddos need strong roots before they can branch out and learn and grow and thrive. So the roots represent how all of us are born with a basic need for connection. This takes us back to early attachment-based research with Mary Ainsworth and Bowlby, et cetera, and recognizing kind of there's two key parts of attachment: exploration and connection. And the roots capture the connection, our need to be in relationship with others, and our need to be nurtured when we are not feeling well. And so when a kiddo feels big, strong, negative emotions, when a kiddo is scared, when they're sad, when they're hurt, when they're hangry, they're down in the roots, and they need a caregiver to do those words in orange. They need somebody who's bigger, kinder, wiser, and stronger to either help nurture them, to help restore emotional balance if they're out of balance, or to help repair a rupture. And a rupture is just when we get it wrong and we need to try again. So I'll give you like some examples, but let me tell you about the branches first. So when a caregiver is being able to see a kid's needs and meet their need for connection, we say a caregiver is being a safe haven, a safe place a child can go back to know that they'll be taken care of. Once those needs are met and a child feels connected, they're better able to build that trunk ring by ring and grow those branches and explore. And exploration in childhood looks like literal exploration. My toddlers go everywhere, touch everything, want to explore everything, right? Exploration is exploring, it's learning, it's playing. Playing is exploration. And it's also, as we grow older and our cognitive abilities grow, exploration is perspective taking, it's being empathic, it's being curious, it's being creative. And when a kiddo is in the branches, they need their caregiver to still be there and be a secure base from which they can go out and come back to. And they need the caregiver to enjoy them, to really delight in that exploration, to help them, maybe by teaching, maybe by setting limits, and to attend to them, to really notice them. And when a caregiver is able to see and meet a child's needs, either in the roots or the branches consistently over time, that's what builds a secure attachment relationship between a caregiver and a child. And this is hard to do. This requires kind of constant curiosity and empathy from a caregiver to think about, where is my child on the tree in this moment? What do they need from me? And how do I meet that need? And it's really hard to do if you've never had anyone do it for you. We can't give a child an experience we've never been given. And so when I think about the mamas and the families in the community that I tend to work with, which are lower socioeconomic, high rates of ACEs and trauma, high rates of mental health and addiction. So many of these parents did not get this type of parenting. And so part of the Mom Power program is helping them feel what it's like to be taken care of, So the group facilitators in Mom Power put the parents on the tree and try to see and meet their needs consistently, so that the parents are better able to do it for the kiddos. And in the context of COVID, when we as adults feel stressed, when we feel strong anxiety, when we feel exhausted, when we are physically sick, we are often down in the roots ourselves. And to be able to do this process for another, we need to be in the branches. And so we can't do this work as providers, as parents, as support givers, unless we get our need for connection met. And we are able to move up in those branches, and then we're able to do this for others. And then the hope is that they're able to do it for others. And we call that the parallel process. Do unto others as you would have them do unto others. Okay. And the kind of summing that notion of the tree up is just this idea of reflective relationships. Slowing down. How you are is just as important as what you do. And to do this, we need strong roots. And so I'll ask you to think about, and if you feel comfortable sharing, I'll invite you to share, to think about what relationships nurture your roots and what activities, this could be coping skills, self-care behaviors, rituals, hobbies, what activities ground you so that you're better able to branch out. So you can answer one of those, both of those, neither of those, but I'll invite you to share in the chat box anything that you feel willing to share about what relationships nurture your roots, what activities ground you so you can branch out. Judy, thanks for finding the bright side. You make me laugh, Judy. Allie walks outside ground you so you can branch out. Thanks for sharing, Allie. Stable, predictable, non-judgmental relationships. Oh, yes. May we all have those. And if we don't have those, may we all find those. Being with others in whatever capacity possible. And Judy, I didn't say one of your ways of grounding is looking on the bright side, which I think is a really helpful coping skill. Time with your dog and gardening, hiking, spending time outside. Thanks, Emily. Dolly, self-care, like therapy helps ground you. Yes, absolutely. Michelle, intentional Zooms with friends help nurture roots. Yes. And sleep. Yes, let's not forget the basics of sleep and rest. Nurturing relationships with partner, kiddos, friends, activities, exercise, walking, yoga, socializing. Yes. Yes to sleep. Novels. Ancestry online. I didn't know that about you, Judy. Zooming with family. Unstructured time with kids. Lots of ways that folks recharge. Girlfriends and non-sent Facebook messages. Yeah. So many ways. There's no right or wrong. What I use to recharge is very different than what my partner uses to recharge. Relationships, working with Janice on projects, frisbee with Bob, water, kayaking with David. Yeah, driving around to look at the Christmas lights. They are really nice. Thanks for sharing, everybody. It's so important to have these close by in our metaphorical tool belts so that as we get in the roots in this time of pandemic, we can take care of our roots and move toward the branches. So I mentioned the parallel process. It's this idea that we have to support the providers. So in a lot of cases, that's you all. I also do a lot of workforce development across the state with frontline providers. And so, there's no end to the parallel process. There's no place where it stops and like we get to a person who no longer needs support. We all need support. And so metaphorically holding or supporting the provider who is holding and supporting the parent or caregiver who is holding and supporting the child. Again, this takes a lot of cognitive resources. It takes a lot of awareness. And so one way that we can build our capacity to do that is through practicing the mind skill, the mind exercise of mindfulness. And I imagine all of you have heard the word mindfulness. It's one that's being thrown around a lot now more than ever. This is a brief video I want to share with you all that I think summarizes mindfulness in a really helpful way and talks about why mindfulness is a superpower. All right, so I'm going to hit play and I'm watching y'all. So if you can't hear it or see it, somebody let me know. Can you hear it? Thanks.
You may have heard this word mindfulness. It's become something of a buzz phrase of late. I'm going to give you one simple, serviceable definition, which is this. Mindfulness is the ability to know what's happening in your head at any given moment without getting carried away by it. Imagine how useful this could be. Just as an example, driving down the road and somebody cuts you off in traffic. How do you normally react? I think most of us, we normally react by having a thought, which is, I'm pissed. And then what happens next? You immediately, habitually, reflexively inhabit that thought. You actually become pissed. There's no buffer between the stimulus and your reaction. With just a little bit of mindfulness, in that same situation, you might notice my chest is buzzing, my ears are turning red, I'm having a starburst of self-righteous thoughts, I'm getting angry. But you don't necessarily have to act on it and chase that person down the road, screaming at them with your kids in the back of the car thinking you've gone nuts. Now, you might be thinking, don't I need to get angry sometimes? Aren't I justified? I would say yes, but probably not as much as you think. The proposition here is not that you should be rendered by mindfulness into some lifeless, non-judgmental blob. The proposition is that you should learn how to respond wisely to things that happen to you rather than just reacting blindly. And that, my friends, is a superpower. How do you get it? The way to get it is through meditation. I believe that meditation and mindfulness are the next big public health revolution. In the 1940s, if you told somebody you were going running, they would have said, who's chasing you? But then what happened next? The scientists swooped in. They showed that physical exercise is really good for you. And now all of us do it. And if we don't, we feel guilty about it. And that's where I think we're headed with mindfulness and meditation. It's going to join the pantheon of no-brainers like brushing your teeth, eating well, and taking the meds your doctor prescribed for you. Let me just close by saying, mindfulness is not going to solve all of your problems. It's not going to render your life a nonstop parade of unicorns and rainbows. Nonetheless, this is a superpower and one that is accessible by you immediately.
I'm glad I'm getting some messages that y'all enjoyed that. I'm glad you like that. I like it a lot. I think, again, mindfulness can get a bad rep. And we think that to practice mindfulness, we all need to like sit around like this with our eyes closed all the time. And that's not true. There's a million ways to practice mindfulness. And so I think if we can think of mindfulness as, nope, there we go. This is not my definition, but it's one that helps me. The awareness that arises, here we go. Okay. Mindfulness is awareness that arises through paying attention on purpose in the present moment, non-judgmentally. That comes from Jon Kabat-Zinn, who's the creator of one of our evidence-based treatments called mindfulness-based stress reduction. And just this notion that it's really just paying attention on purpose. It's training our brain. Our brains are so good at being anywhere but the present moment. We're really good at ruminating on the past to remember all the things we did wrong or that didn't go the way we wanted. We're really good at worrying about the future. And our minds are really not designed anymore to stay present in the moment. Little kids are great at this, but as our prefrontal cortex develops and that adult thinking, planning, inhibiting, think before we act, worry enough to buy health insurance part of our brain develops, our ability to be in the present moment decreases. And so we really have to train our brains to be present in the present moment. I put some books up there that I really love. These are Thich Nhat Hanh. He has a series of small books. They're like just the right size to keep in your purse or car, on just different ways to practice mindfulness through things like eating or sitting. There's some apps, Stop, Breathe, and Think, or Calm. I invite you all to share any resources in the chat box that you love to use if you have any kind of mindfulness practice. It might be apps, websites, videos, books that you enjoy. I think the more the merrier there. All right. Okay, briefly, some things I hear when I talk about why it's so important to take care of ourselves. Maybe there's a thought that it costs too much. And if we think about self-care as being a tropical vacation, then, or a trip to the spa, it absolutely probably costs too much and is not sustainable. Also, the thought that I don't have time might get in the way. And I just like to counter, there's also, I didn't put it in here, but a lot of people have the thought that self-care is selfish, or I feel guilty if I do self-care. And whenever I hear the final concern that it's selfish, I counter with, you can't take care of yourselves if you don't take care of yourself. You can't take care of others if you don't take care of yourself, and how we have to take care of our roots in order to branch out and to do good work and to be caring, thoughtful providers, partners, parents, etc. We need to be in the branches. And so really self-care is on behalf of others. It's meant to help us be more reflective and attuned in our relationships. And for the I don't have time and it's too expensive, I've developed this little acronym that helps me think about how to get the most bang for my buck out of nutrient-rich self-care time. This came from having toddlers and like only having like 5 minutes a day where I feel like I can do self-care. So if I'm going to do it, what do I want it to be? I want it to be something that's regulating to me, that regulating means kind of adjusting. If I'm feeling really anxious and hyped down, I kind of want it to down regulate me, to calm me down. If I'm feeling really kind of depressed and low, I might want it to up regulate me and bring me up. So it kind of requires me to be aware of how I'm feeling to know which way I want to go for regulation. It's like turning the thermostat up or down when we think about regulation. But thinking about how am I feeling and what do I need for regulation, that means it's got to be intentional. Sometimes we get in habits of doing things like I might put the kids down for bedtime and think like, oh, it'll be so relaxing to just lay on the couch and scroll through Instagram. And I don't know why I think that, because every time I do that, I do not feel more relaxed after the time I'm done. So it's not intentional self-care time if I lay on the couch for 15 minutes and scroll through social media. Calming, again, what calms me might not be what calms you, but kind of asking, will this help me feel calm? And honest. Again, like some people, I think we get either in cultures or groups or habits where we think, oh, this is how I should do self-care. Self-care should mean I take a bubble bath. But every time I take a bubble bath, I just lay there thinking about everything that's stressing me out. So maybe bubble baths are not your self-care if that's what you do. Just like, or I should wake up at 5 a.m. and go for a run. If every day you wake up at 5 a.m. and you go for a run and you're miserable, that is not self-care. That is something else. So really thinking about what helps me regulate, how will I be intentional? Will this help me feel calm? And am I being honest with myself? All right, briefly, I'm going to fly through these resources so we have time to take the PowerPoint off and just have a discussion about anything related to anything I've talked about. But some local resources for y'all to know about. Dr. Skatsina mentioned the Appalachian Perinatal Mental Health Alliance. Judy McCook is a part of that with me. And this is just a regional nonprofit. We're under Postpartum Support International and Postpartum Support International Tennessee. And we do just a lot of grassroots work regionally to raise awareness about mental health difficulties in pregnancy and postpartum, and how to increase our workforce and its ability to meet those needs. So we do a lot of awareness around this, stigma decreasing, and training for providers. Cherished Mom is another local nonprofit that was started by Christina Dulaney, who helped start the other one. And Cherished Mom offers free online support groups. It's peer-led support. And right now they have a group for perinatal mental health struggles. They have a group for NICU parents, and they're about to start a group around perinatal loss. So just recognizing that that's some kind of regional resources. I've mentioned Mom Power. That's a whole nother talk, but I'll just let you know it's an evidence-based parenting program for mamas of young kiddos. We really try to reach mamas who have a lot of psychosocial risk factors, and it's meant to help kind of, again, meet mama's needs so she can better meet kiddos' needs. We are doing that still in this time of COVID. We're just doing it virtually. Here's the Cherish Mom support groups. I also forgot there's an infertility support group through Cherish Mom. And then there's a list of resources of different counseling resources and community organizations who are perinatal mental health informed and have gone to specific training to be aware of perinatal mental health challenges. Some state resources, our State Association of Infant Mental Health called Aim High Tennessee. I cannot pump enough. If you aren't on their listserv, I encourage you to join their listserv. Michelle Mosier is one of the founders of Aim High Tennessee. It's really the group, if you want to stay connected with all incredible things happening for infants, young children, families, caregivers, and the systems supporting them, get involved in Aim High Tennessee. Chant is a new-ish rebranding, reorganization of our Department of Health's referral system related to community resources for children and families. And so I just want you to know that kind of if you had a family and you weren't sure how to connect them into services, Chant might be the right home to go. And then the Chant folks help think about what resources are in the community and how to connect there. MHeart is something that comes out of the Tennessee Department of Mental Health and Substance Abuse. This is a pro bono service for frontline providers that offers a support line where folks who are on the front lines can call and get support around COVID stressors or mental health issues. And then there's also, they're trying to launch pro bono therapy services for those frontline providers. Nationally, anytime you want anything parenting or young kiddos, I recommend you go to 0 to 3's website. And I really love PBS Parents website. So 0 to 3 is a national organization that does a lot of policy advocacy, training awareness around early infancy and childhood development. It's very evidence-based. Same with PBS, but I think PBS is more geared toward the parent, whereas 0 to 3 is more parent and provider resources. They both have great resources on how to talk to kids about COVID. PSI National also has a lot of online support groups for a range of parents experiencing a range of stressors. So here's where you're going to get the most breadth. For example, they have perinatal mental health support groups for mamas, for dads, for LGBTQ plus folks, for Black, Indigenous, and people of color, for people who have experienced loss, for military families. So if you have any perinatal, postpartum, early parenting stressor related issues and you're looking for support, I would check out PSI National. All right, y'all, that is it. I'm going to turn off the share screen. I invite your questions, but even more so than questions, I'm really looking forward just to hearing what additional thoughts you have, resources, ideas, etc.
Thank you so much, Dr. Moreland. That was very engaging presentation. I appreciate all of the concepts and resources that you shared. I saw that Julia Dodd chatted in a resource that I actually wasn't familiar with, How to Train a Wild Elephant. Is anybody familiar with that? I Googled it. It's a book about mindfulness.
No, I haven't, but I'm excited to check it out.
So it's a bunch of activities that lend themselves really well to sort of the approach you were talking about, Diana, where you don't have time to go to the spa or meditate for an hour. So one of the exercises is like brushing your teeth mindfully, for example, and, you know, mindful walking, mindful eating, a lot of those common activities that I think it's just kind of a fun one to recommend and a way to think about mindfulness a little bit differently.
Awesome. Thank you, Julia.
That's great. And I put one in the chat that I found early on in the pandemic. I think it was shared via a professional organization. It's from Psychology Tools, and it's called Living with Worry and Anxiety Amidst Global Uncertainty. So I've used some of those strategies myself and then shared that with colleagues in faculty development and department meetings. But sometimes it's the little things like mindfulness while you're brushing your teeth. I love that you can easily incorporate, and it helps a little bit. And I think, yeah, if anybody has other ideas, I think just this has been a long stretch. 2020 has been long, so I'm always looking for new ideas.
Too.
Anybody else with questions or comments, or even if it's off, somewhat off topic?
Can I add? I don't want to talk over someone. So when I initially read the title about health for caregivers, I was really intrigued because I'm associated with a nonprofit called Jeb Foundation Advocates for the Elderly. And one of the upcoming projects or services that they want to provide is free health care, is free respite care to caregivers. So I do like that you kind of went through the different platforms for caregivers, caregiving for children, caregiving for in the healthcare field, and and I can take that information and compare it to caregiving for the elderly too, because those are also stressors. So this was really good information.
Thank you, Catherine, and thank you for joining. Yeah, and I know I mentioned early that stat that those who are caregiving for the elderly are at some of the highest risk for mental health symptoms during COVID. Do you know of resources? Because I didn't share any national resources that are specific to that group. I'm curious if you know of any.
So Jeb Foundation is based out of Johnson City here, and they serve seniors, specifically those who are suffering from depression. And so again, they have a home care service, but one of the things that are coming up probably in the year 2021 is free respite care for caregivers. I know NAMI is also a really good local resource, and that's for mental health. They have support groups there as well.
Thank you so much. Does anyone know, we're getting to about to graduate a Mom Power cohort, and we often look for ways to keep our mamas connected. Usually we have things like MOPS or, library story time if we're just looking for community connection as opposed to mental health related connection. Does anyone know of any parenting virtual support groups that are not mental health affiliated?
I know there are a few Facebook groups specifically for moms, specifically for like postpartum. I can't say that they are targeted, and I can't speak on whether they have support groups, but I know those Facebook groups, they're they're pretty popular. So
I see some, I feel bad calling you out. And I was going to say, Samantha, thank you. Holding virtual parenting support groups and the Leche League support groups on a weekly basis. Okay, that's wonderful. And Samantha, are those virtual parenting support groups through kind of attached parenting?
Yes, the parenting groups are through attachment parenting and kind of with Bristol's Promise as well, which we have a lot of parenting resources on our site. We're actually doing a parenting class right now, and it's for any parent. It's free of charge. It's on Thursday evenings, and it's a very attachment focused parenting class, but it also endeavors to provide just kind of general, support and connection, community for parents. And then, of course, the Leche League's meeting pretty much every week, but at different times every week, and people can sign up. And it's breastfeeding support, but we welcome any parents. We even help with bottle nursing and weaning and anything that parents need, or just to talk.
Wonderful. That sounds like a perfect, especially the attached parenting group, a perfect next step for our Mom Power mamas, because they're coming out of an attachment-based curriculum. Thank you.
Yeah, and thank you for sharing, Samantha and Catherine, about the Jeb Foundation. I saw Lauren Biggs put a couple of resources. Again, these are books I'm going to have to check out. Put these in the chat. When Things Fall Apart by Pema Chidran. And then After the Ecstasy, The Laundry, How the Heart Grows Wise on the Spiritual Path. So thanks for sharing those. We've got just a couple minutes left. Does anybody else have any questions, comments, thoughts or resources they'd like to share? That's a great reminder about the parenting classes. I've been trying to help get the word out about the Bristol's Promise parenting classes that are virtual right now, because I think that's just such a wonderful resource.
Mm-hmm.
So we
really briefly, because I know Holly Reeves was here and left, that Carter County Drug Prevention Coalition, those folks are doing Triple P virtually, and both group and individual parenting classes. So that's another local parenting resource to know about.
That's great. I don't think I had heard that. I'm familiar with Triple P, but I don't think I realized that Carter County was using that. That's great.
Mm-hmm.
Mm-hmm. Well, thank you, everyone. As I said at the beginning, we do record these presentations, and I think we've probably also been able to capture some of these resources that have been shared via the chat. So that video will be posted on our website. We are going to be some additional recruitment for the Child and Family Health Institute in January, because it is a new institute at ETSU. But I invite you to check out our website if you haven't already, and we are looking for new members in the institute. Our next session is going to be January 19th from 12 to 1. And Dr. Marty Olson, who's a professor in the ETSU Department of OBGYN, is going to be sharing his experience and his research related to prevention of neonatal abstinence syndrome and care for women prenatally who are affected by drug use disorder. So we hope you all can join us for that. And thank you again, Dr. Moreland. That was just wonderful, timely, helpful presentation and discussion. So I hope everybody has a great rest of the week and month, and stay safe and
Thank you so much for having me, and thanks everybody for joining and participating. All right, we good to go?